Hello everyone, this is Dr. Abdullah Kemal and today we have a brainstem lesion stroke. So first of all, we have 71-year-old patient with history of hypertension, atrial fibrillation, chronic renal failure, was admitted to the ER with right side weakness and loss of sensation. On examination, it was found to have left side ptosis, facial weakness, and diminished hearing. Brain imaging revealed the conclusion one of the arteries, which artery is most likely to be involved. Okay. Um, so we have six choices: right middle cerebral artery, left middle cerebral artery, right anterior cerebellar artery, left anterior cerebellar artery, left posterior cerebellar artery, right posterior cerebellar artery. So that's a brainstem stroke or brainstem lesion. So we have to review the brainstem, the blood supply, the anatomy, and cranial nerves. Okay, so let's just start. So the brainstem, we have midbrain, then we have pons, then we have medulla, and that's medial and that's lateral. Okay, what about the blood supply? The blood supply, we have anterior circulation and posterior circulation. The anterior circulation supplies cerebral cortex, posterior circulation supplies cerebellum and brainstem. So the anterior circulation basically comes from internal carotid artery and its ACA or anterior cerebral artery, and MACA, which is middle cerebral artery. So if we have anterior cerebral artery, we should have posterior cerebral artery, and from the name, posterior cerebral artery comes from posterior circulation. So let's draw the posterior circulation. We have those, and those, okay? So we have two vertebral arteries combined together to give the basilar, and the basilar at the very end gives posterior cerebral artery. So we have anterior cerebral artery, middle cerebral artery come from internal carotid artery, but posterior cerebral artery comes from the basilar, and the basilar is the combination of the two vertebral arteries, right and left. Okay, and here we have this guy, which is anterior spinal artery. And why we call it anterior spinal artery? Because basically we have the spinal cord here, okay, and the anterior spinal artery supplies the anterior part of the spinal cord, hence the name anterior spinal artery, okay. Then after that we have here the superior cerebellar artery. So if we have superior cerebellar artery, then we have inferior cerebellar artery, right? Actually, we have two inferior cerebellar artery. One is here, and it's called ICA, or anterior inferior cerebellar artery, and the other is here, which is PICA, or posterior inferior cerebellar artery. So again, we have anterior circulation, ACA, MACA, posterior circulation. Posterior circulation starts from the vertebral arteries down. Two vertebral arteries combined together give the basilar. The basilar ends with posterior cerebral artery. We have the anterior spinal artery. Anterior spinal artery supplies the anterior part of the spinal cord and part of the medulla. Then we have superior cerebellar artery, and we have inferior cerebellar artery. Actually, two inferior cerebellar arteries: anterior inferior cerebellar artery and posterior inferior cerebellar artery. Okay, so what about the cranial nerves? Okay, so before going to the cranial nerves, we have two rules. We have two rules. First rule is I call it 4 and 4 and 4, which means for the first four cranial nerves arise from um, above the pons. The next or the middle four cranial nerves arise at the level of pons. Then the last four cranial nerves arise from below the pons, which is the medulla. So let's apply this. So we have 1, 2, 3, and 4 above the pons. Actually, it's 1 and 2 here, 3 and 4 here. So 1 and 2 comes from the cerebral cortex, 3 and 4 from the midbrain. Okay. Then the next four we have 5, 6, 7, and 8 from the level at the level of pons. Then we have 9, 10, 11, and 12 at the level of the medulla, okay? So that's the first rule. The second rule, it says motor nerves are medial, others are lateral. And what I mean by motor, pure motor, okay? M with M. So which of those are motor? So we have 3 and 4 motor, and we have 6 motor, and we have 12 motor. So let's just rearrange this pretty fast. Here we go. So we have here 3 and 4, then 6, then 12, and the rest are lateral. So we have here 5, 7, and 8. We have here 9, 10, and 11. Okay? So here we apply the two rules for cranial nerves, which are 1, 2, and 3, 1, 2, 3, 4, above the pons, 1 and 2 from the cerebral cortex, 3 and 4 from the midbrain. The next 4 from the pons, and actually 6 is motor, so it's medial pons, and 5, 7, and 8 are mixed, so they are from the lateral pons. Then after that, we have 12 from the medulla, medial medulla, because it's motor, and we have 9, 10, and 11 from the lateral medulla, because they are mixed. Okay, so what about the blood supply? Actually, the blood supply is pretty straightforward. So if we look at the midbrain level, if you look at the midbrain level, okay, you're gonna find posterior cerebral artery. Posterior cerebral artery. So we have here posterior cerebral artery supplies the lateral and the medial midbrain. Okay, what about the pons? The pons we have lateral and medial. So medial, it's obvious here. This is the medial part, which is from the basilar. So we have basilar, and the lateral part here from ICA. Okay, then after that we have the medulla. The medulla, if we look medially here, we're gonna find the anterior spinal artery, and if we look laterally, we're gonna find posterior inferior cerebral artery, which is pica. So again, pretty fast: brainstem, midbrain, pons, and medulla, lateral and medial. Okay, midbrain, we have 3 and 4 cranial nerves from the medial side because they are motor, and all the midbrain, either medial or lateral, is supplied by posterior cerebral artery. What's after? It's the pons. The pons, we have medial pons and lateral pons. Medial pons, it has the cranial nerve 6, and it's supplied by the basilar artery. Lateral pons, we have cranial nerves 5, 7, and 8, supplied by ICA. Then after that, the medulla, we have medial medulla, lateral medulla, medial medulla, cranial nerve 12, and the blood supply from anterior spinal artery, lateral medulla, cranial nerves 9, 10, and 11, and the blood supply comes from pica or posterior inferior cerebral artery. Okay, so if we are talking about lateral pontine syndrome, so we have here the brain stem. So we have here midbrain, then pons, then medulla, and here we have descending tract, which is motor, and we have ascending tract, which is sensory, and we have the sympathetic fibers. Okay, let's get back to the brainstem. So we have midbrain, pons, and medulla. Here is medial, here is lateral. Okay, so we are talking about pontine syndrome. Then we are in this level, then lateral. So here we are talking here. So the lesion location is here. So what cranial nerves are here? We have 5, 7, and 8. And what is the blood supply? It's ICA or anterior inferior cerebral artery. So basically, lateral pontine syndrome, it's a stroke in the anterior inferior cerebellar artery or ICA, and that could be hemorrhagic stroke or ischemic stroke, the same effects at the end of the day. So, what are the symptoms? So, the symptoms first, if we have lateral pontine syndrome, we have those cranial nerves affected and we have those tracts affected. So, if we look, first of all, we have the descending tract. which is pure motor. So we have motor weakness. Okay, then after that, we have the ascending tract, which is sensory loss, pain, and temperature. Then we have the sympathetic tract, and sympathetic loss leads to Horner syndrome, which is ptosis, meiosis, and hydrosis. Okay, and we have the cranial nerves, which are 5, 7, and 8. Actually, for lateral pontine syndrome, cranial nerve 7 is very characteristic. So we have the facial nerve lesion. And what is the function of facial nerve? Is it motor or sensory or parasympathetic? Actually, it's the three of them. So we have motor symptoms, we have sensory symptoms, and we have parasympathetic symptoms. So motor, it it involves the facial muscle plus two, the two muscles orbicularis oculi, and the stapedius muscle, eye and ear. Okay. Then sensory, it is responsible for the taste from the anterior two-thirds of the tongue. Then parasympathetic, lacrimation and salivation. So in lateral pontine syndrome, you lose all of this. The next question, ipsilateral versus contralateral. So actually those symptoms, the descending and the ascending tracts is contralateral, because the descending tract, which is here, it decussates later. So the lesion here in the level of the bones, at the level of the bones, but actually it decussates later in the medulla to go to the other side. So it will give contralateral side symptoms. And the ascending lesion, which is sensory, actually it decussates or cross at the level of the spinal cord. Okay, so it's contralateral as well. So the descending or the motor and sensory symptoms are contralateral, okay? And the sympathetic and the facial nerve ipsilateral. So let's get back to the question. Okay, we have descending tract, which is right side weakness. We have ascending tract symptoms, which is loss of sensation. We have sympathetic Horner syndrome, part of Horner syndrome, which is ptosis. And we have cranial nerve 7 and cranial nerve 8 symptoms. So all of this indicate lateral pontine syndrome or ICA lesion, okay, or ICA lesion. Okay, so is it right middle cerebral artery? No. Is it left middle cerebral artery? No. It is right anterior cerebral artery, maybe. Left anterior cerebral artery, maybe. Left posterior cerebellar? No. Right posterior cerebellar? No. Okay, so now we have anterior cerebellar artery, but is it right or is it left? We said the body lesion is contralateral, but face or facial symptoms and Horner syndrome ipsilateral. So right side weakness and loss of sensation, so that's contralateral, so the lesion in the left side. And this affirmed by the left side ptosis and facial weakness, so the right answer here is left anterior cerebellar artery. Left anterior cerebellar artery. And actually the last thing I want to review is the difference between Bell's palsy, lateral pontine syndrome, and stroke symptoms, okay? If we are just looking at the face, what will be the differences between Bell's disease or Bell's palsy and lateral pontine syndrome and stroke? So before we do that, we need to compare fast between lower motor neuron lesion and the upper motor neuron lesion. Lower motor neuron lesion, it involves the upper and lower face, while the upper motor neuron lesion, it involves lower face only, okay? Then lower motor neuron lesion is ipsilateral, while upper motor neuron lesion is contralateral. So if we have three faces here, let's do another color. We have 1, 2, 3 eyes, nose, mouth, ears, eye, nose, mouth, ears, eye, nose, mouth, ears. And here we have Bell's palsy. We have here lateral pontine syndrome, and we have here cortex stroke. Okay, so Bell's palsy basically it's a cranial nerve 7 or facial nerve lesion, and that's it. It's just facial nerve. Okay, it's just facial nerve. What is the reason? It depends. Like it can be viral infection like HIV. It could be Lyme disease. It could be autoimmune. It could be multiple sclerosis. It could be idiopathic. It could be autoimmune. A lot of reasons can cause Bell's disease. Okay, what caused lateral pontine syndrome? Lateral pontine syndrome is posterior circulation stroke, while cortex strokes it's anterior circulation stroke. So that's anterior circulation stroke, but that's posterior circulation stroke. So both of them are strokes, and they could be hemorrhagic or ischemic. Okay. So first of all, Bell's palsy. Bell's palsy, is it lower motor neuron lesion or upper motor neuron lesion? It's lower motor neuron lesion. And if it's lower motor neuron lesion, then upper and lower face are involved. So we have here involved and we have here involved. Okay. And actually, so what is the function of the cranial nerve 7? We said facial weakness, upper and lower, and it gives rise to it supplies two muscles, which are orbicularis oculi, or orbicularis oculi, and the stapedius. Orbicularis oculi and stapedius. Okay, so that's Bell's palsy. It's lower motor neuron lesion, so it involves upper and lower face. Ipsilaterally. Okay, let's move to lateral pontine. Lateral pontine syndrome, we said the facial muscles are ipsilateral or ipsilateral to the lesion. So if we have ICA here on the right side and we have the lesion here, so we have um, we have the septums ipsilateral, so we'll have here upper and lower face weakness, and we have orbicularis oculi weakness, and we have stapedius weakness. Okay, but actually we have the sensory loss, which is a taste from the anterior to third of the tongue, and we have parasympathetic loss, which is lacrimation and salivation. Okay, so that's lower motor neuron lesion as well, so it's ipsilateral. If we go to the stroke symptoms, that's upper motor neuron lesion, and if it's upper motor neuron lesion, then it involves only the lower face, so it only involves this part, the lower face, and it has to be contralateral, so it's the other side. So it's the other side, okay? So if we compare, let's compare very fast between Bell's palsy and lateral pontine. So if we see both involve cranial nerve 7 lesions, how can you differentiate? Actually, you can differentiate because we said here descending, ascending, sympathetic, and cranial nerve 7, right? But here you only have cranial nerve 7. So in Bell's palsy, you only have facial septums, cranial nerve 7 lesion septums. But in lateral pontine syndrome, you have descending septums, which is contralateral weakness, contralateral body weakness, and we have ascending septums, which is loss of pain and temperature, contralateral, and we have sympathetic septums, which ptosis, meiosis, and anhidrosis. So that's how we differentiate between Bell's and lateral pontine. So how to differentiate between lateral pontine and cortex stroke? As we said, this is lower motor neuron lesion, while this is upper motor neuron lesion. So you can differentiate between this is ipsilateral, but this is contralateral. And here you're gonna find cranial nerve 7 lesion septums. Here you don't have those septums. Here you only have the descending and the ascending septums, but you don't have this part or the facial nerve lesion symptoms. And that's about it for today. Please let me know if you have any feedback or question. Have a great day.